How has government in Southeast Asia responded to the COVID-19 pandemic? This is a really fantastic question, and one should require you to understand that countries in Southeast Asia actually experience COVID-19 quite differently. The first thing to look at, of course, is the number of confirmed cases. And looking at these alone, you can see that there's largely two groups of countries in Southeast Asia. One with low numbers, which include Vietnam, Timor-Leste, Myanmar, Laos, Cambodia, and Brunei. And these countries have fewer than 1,000, or just a little tiny bit over 1,000 for Vietnam. The other group is considered a medium to high case number, and that includes Indonesia, the Philippines, Singapore, Malaysia, and Thailand. And when you see that variation in the number of confirmed cases, you also see variations in the way governments across the region responded to the pandemic. So today I'd like to discuss three main points. First, there's no conclusive evidence that a hard and fast lockdown is actually better. So some countries moved in really early, locked down really fast, and did really hard lockdown. And the earliest case is the Philippines, with a very severe, and still today, the most severe lockdown case in the region, and that happened on March 15. And the timing of lockdowns really didn't have anything to do with the timing of the first confirmed case. Looking again at countries' confirmed cases today and trying to understand whether countries that have imposed more severe and early response did better wouldn't tell you much. And that is what we're witnessing for the first 6 months in the region. Secondly, there has been a common trend of increased autocratization in the region, particularly by governments. It's the increasing use of measures to exert greater control, not just over the handling of the pandemic, but over the civil and liberty rights of the citizens as well. Emergency decrees or invoking of emergency powers were commonplace. For example, Indonesia, Singapore, Cambodia, Thailand, which was extended 3 times. The Philippines is a notable case. It actually passed a legislation, anti-terror bill, and it basically gave significant power to the executive, President Duterte, to decide what constitutes terrorism. And it evoked such strong responses from the citizen that people went out to protest in the middle of a lockdown in a pandemic. We have to remember that the Philippines is one of the very few cases of a democracy in the region. And for a democracy like the Philippines, really raised a red flag as to the potential implications of this crisis on political liberties in the region generally. The third point I'd like to mention is the importance of understanding non-state actors. It's particularly mobilization of civil society and religious organization in filling the void. Most of the lockdown measures didn't come into place until March, the end of March, sometime April. So what happened in January? And what happened in February? How did these countries respond? And to answer that, you can't look at what the governments did, but what the society did to come together. A number of civil society organizations and religious organizations really fill this void. Of note, I'd like to mention the role played by the village health volunteers in Thailand, who had been in operation, since 1970s, and basically acted as a cushion between people in the villages and the state health authorities. They're really the front line of the public health response in Thailand. So my take-home point today is that, number one, governments didn't do it alone, and it will be a mistake to look at government responses as the only responses or even the primary responses country had for managing or handling this pandemic. Secondly, there is serious transparency in the way we could understand government response, right? Some governments were more upfront about the situation than others. Some continue to refuse to release official statistics of testing, for example. And third is that political impacts of COVID-19 will vary significantly. So just to give you an example, Thailand is often considered as one of the best performing countries when it comes to COVID-19 response. It did extremely well, had very low number of confirmed cases, but also lower numbers of deaths. And you would think that the success of the first 6 months of the government would actually boost its popularity. And yet, just a few days ago, thousands of people, especially young people, came out to the street to protest against the government and demanding a resignation of the government, right? So it just shows you that even if you seem to be handling the crisis well, that you were praised as a successful case, it in no way is guaranteed that the government would be stabilized or secure or would receive continued public support.